Thank you all for your patience. All right, so once again, on behalf of St. John's Orthodox Syrian Church, Andheri, I warmly welcome Dr. Samrat Chauhan and his team from L.H. Chiranandani Hospital, who have come today to educate us on the emergency life-saving procedures. To start with, we will warmly welcome them with a handheld flower bouquet. I'll be calling out the names and requesting one of us to please hand over the flower bouquet. All right, so for Dr. Samrat Chauhan, warmly welcome you, Dr. Samrat Chauhan. Please accept a token of thanks and appreciation. Well, Dr. Samrat is an associate consultant, emergency physician. I would request Ms. Sally Sushil, Director of Nursing, to please accept the flower bouquet. We also have with us, thank you, Mr. Sheel. We also have with us Diabetic Director, who is Mr. Nazimuddin Qazi. Can we warmly welcome him? Thank you, Mr. Qazi, for being here. We warmly welcome you on behalf of St. John's Church. We also would like to request Mr. Bhagat Singh, who is from the marketing team, please, to come on stage. Thank you, Mr. Bhagat Singh. We also request Mr. Naveen Gujran from the marketing team to please come up. I would now request I also thank our Vigar, Father Sibi, for arranging all of this and being here to always support us. I would now be concluding the welcome and we can quickly proceed to the next proceedings.
Yeah, am I audible to all? Good morning. Record. So thanks for giving your Sunday time to us, to spread the awareness about this. Yeah.
Hello, testing mic.
I believe I'm audible now. I think I held it wrong. It's fine. Yeah. Am I audible? Yeah, much better. Yeah. So I'm here to talk about CPR. All of us have heard about it, I believe. We in medical language call it basic life support or cardiopulmonary resuscitation. Most commonly, it's referred to as a CPR. Just to give a gist, what it is. So all of us happens to the hero of the movie, and he sort of dies. And then usually he's taken to the hospital and a shock is delivered to him with a device, and then he gets revived and starts fighting up with the villains, and in the end takes the trophy as well. So how many of you actually believe that it happens? It truly happens. Is there any believer? Yeah, true. And he's right. That absolutely happens. That's what we do almost every day in the hospital. And I'm here to teach you exactly how to do that. So, to begin with, next. So, what is BLS or CPR I spoke about? It's nothing but series of actions performed on a critical ill victim, that is someone who is in a cardiac arrest, with an aim to buy time till the expert medical help arrives. And who can perform this CPR? It can be performed by any medical personnel or a trained bystander. So hopefully by the end of today's talk, you all will be that trained bystander. So why is it important? So why is it important to learn the CPR? So what is our usual response whenever there is any emergency at home? What do? We call up the doctor at home or we call the ambulance services and we take the victim to the hospital, right? But various studies have been conducted worldwide, and which have shown that if the CPR or this BLS is provided by the bystander, by bystander I mean the one who witnesses someone getting unconscious or unresponsive, it increases their survival rate by almost 4 times, that too without any significant neurological damage. Okay? Yeah. So, conduct these classes in a medical class. Forget about performing it. So, I'm going to keep it very simple. All you have to do is remember these 7 letters, doctor's ABCD, where each letter stands for a specific action. For an example, letter D stands for checking for danger, letter R stands for checking responsiveness, letter S stands for scream for help, shout for help, or send for help. And letter ABCD stands for the specific action, that is checking their airway, checking their breathing. C starts for giving CPR and D for applying defibrillator. Let's get started with these letters. So coming to the first letters of doctor's ABCD. So whenever you have come across a scenario where you witness someone lying unconscious or fainting in front of you, first thing you should do is look for the scene safety. Look for any danger there. For an example, if you yourself don't know how to swim and if you try and save some drowning person, I'm sure there would be 2 victims instead of 1, right? So your own safety, victim safety, as well as those around you should matter. Like for example, if there is electrical short circuit, someone gets electrocuted and that person, goes into cardiac arrest. If you go there and start giving CPR, I'm sure there are chances you yourself may get electrocuted. So what you have to do in such scenarios, you have to take the victim to the safer side. If there is a short circuit in a room, then take the victim to the other room or lobby and then start with the CPR. Coming to the next letter, that is checking responsiveness. Letter R, which stands for checking victim's responsiveness. So as I said in the beginning, these are the series of actions performed on a critically ill victim in a simple word who is in a cardiac arrest. So before you proceed with the next steps, you have to make sure that the victim who is lying unconscious there is truly unresponsive. It shouldn't be like, it was a Saturday night and that person has had one too many and just sleeping there. Okay, so how do you check the responsiveness? So there is again no scientific method involved in it. You can just go close to the victim, tap hard on the victim's shoulder, and call him out in any language you feel the victim would be able to understand. You can ask them any series of questions. Just, can you open your eyes? Can you lift your hands? Can you speak to me? Can you open your eyes? And if they respond to any of these questions, that means victim is still alive, that is still unresponsive, not in cardiac arrest. In that case, you call the experts and just wait it out. In case if you don't get any response there, you move on to the next step, that is letter S, which stands for shout for help or send for help. So, So as I said in the beginning only, your aim is to buy time till the expert medical help arrives. Ultimately, the expert help has to come and has to diagnose why that person has gone into the cardiac arrest. Whether he suffered from a heart attack, kidney failure, malaria, some other infection, or massive stroke and all. So you have to call an expert so that they take care of the emergency further. So once you have done these 3 basic steps, you move on to the next step. That is checking airway and breathing of the victim. So how do you check for airway? You again just go close to the victim and perform this maneuver. We call it head till chin lift. In a simple, you extend their head a little bit. So what happens when you do that? Their tongue gets pushed forward, and if they are still not completely into the cardiac arrest, they will be able to breathe. Okay, and in case if they do not breathe after that, you have to start with the CPR. But how do you check for the breath? Next slide, please. Yeah. So how do you check for the breath? So every time we breathe, three things happen. We call it look, listen, feel technique. So every time we breathe in, we all make this sound, right? Plus, with every breath, our chest rises and falls. Third thing is which happens is every time we exhale it out, you will be able to feel the gash of air coming against your skin. So that's what you have to check. So how do you check? आप वो निकाल लो भगत सिंह जी. Yeah. So I'll just demonstrate to you so that you will be able to understand in a better way. So this is how we expect a BLS is given by a non-medical personnel. If you come to the hospital, we don't really check for airway and breathing. We directly check for the pulse, the which pulse? Carotid pulse. All of us, we have that pulse going on right now. How do we check for that pulse? We all have this structure in the center. We call it Adam's apple, right? Or the trachea. So if you rotate, turn your neck, head to one side, you will see this prominent muscle. We call it sternocleidomastoid muscle. In the groove between these two, if you keep your fingers, you will be able to feel the pulse. If you know how to feel for the pulse, please go for the pulse check, which is more reliable. But if you don't know how to check for the pulse, then do as I demonstrated to you. No, this is fine. This is fine. Better rather than table, this is okay. So this, in the beginning, as I said, you look for the danger. No, I know. That's fine. Thanks. Yeah. So first thing you do is look for the scene safety. Once the scene is safe, you check for the responsiveness of the victim. How do you check for the responsiveness? You go close to the victim, tap on his shoulder or her shoulder, call them out, John, are you okay? Can you open your eyes? Make sure like someone is unconscious there. So be really loud and tap their shoulder really hard. If you get any response, you stop there. If you don't get any response, next thing you do is call for help. If you are alone, use your mobile phone to inform the nearest hospital which has the emergency and ICU care setups. Next thing you do is quickly check their pulse. If you don't know how to check for the pulse, then you open their airway and check for the breathing. As I said, how do we do that? We simply do this maneuver. We call it head tilt chin lift. Okay? And once you have done that, you exactly take this position with your eyes on the chest, scanning for rise and fall. With your ears, try to feel. Yeah, we'll have a demonstration again. Up here? Yeah, sure. Gets comfortable for me also. Yeah, so first, scene safety, look for danger. Second, check the responsiveness. Third, ask for help, send someone for help. Next, open the airway by performing head tilt chin lift. Once you have done that, check for the breathing. Eyes on the chest, scanning for any rise and fall. With your ears, try to feel the breathing sound. Plus, try to feel the gush of air coming against your cheek. Like, spend at least 5 seconds checking all this. You have to be really fast. But do not waste more than 10 seconds looking for pulse or checking for breathing. In 10 seconds, if you do not feel the pulse or you do not see the person, the victim breathing on his own, you move on to the next step, the most important step, that is starting the CPR. So, how do you start the CPR? First of all, you have to make sure that the victim is lying on its back. In medical language, we call it supine position. Victim has to be on a firm and hard surface. If such emergency happens at home, make sure that the victim is taken on the floor, because the kind of mattresses we use these days, if you start giving CPR there, I'm sure you will just end up compressing the mattress rather than the chest. Okay? Then you have to identify a specific point as shown as a green dot in that figure. That is exactly where your central bone is. All of us, we have this bone in the center. We call it sternum, breastbone, or a central bone. You have to identify the lower half of it which is at an imaginary line joining the two nipples. That's where you keep your dominant hand. If you are a right-handed, right, left-handed, left. Interlock it with your non-dominant hands. I'll demonstrate it to you and start giving the CPR. This is how you do it. Dominant hand, interlock it with your non-dominant hand. Lean over the victim and then start giving the CPR. Make sure your hands have to be and elbows have to be straight, and the force of compression comes from your body or shoulder, not hands or the elbow. Otherwise, you will end up getting tired very easily. Plus, the chest compressions will not be effective. And how many chest compressions have to be given? In a minute, your aim is to give at least 100 to 120 chest compressions in a minute. And ideally, after every 30 chest compression, you should give them 2 rescue breaths. How do we give 2 rescue breaths? In the hospital setting, we use, specialized mask, ambu mask, to deliver them breath. But I'm sure at home, in the offices and all, we do not have all those masks. So how can we give them mouth-to-mouth respiration? We has to be given. So how do we give that? So first, you have to take a deep gash of air in, perform that same maneuver, we called it head till chin lift. This time, close the victim's nose, close the victim nostrils, form a seal around victim's oral cavity and deliver them 2 quick breaths and then resume with the CPR. Again, as I said, the rate of compression has to be 100 to 120 in a minute. Plus, after every 30 chest compressions, you have to give 2 rescue breaths. So my question to you all, how many of you will be comfortable giving this mouth-to-mouth respiration to a stranger who you barely know or don't even know? You all will be comfortable giving this? No, I appreciate if you are. But if you ask me personally, if I have to give, probably I will not. Why? Obviously for hygienic reasons, Because most of the time when you come across such victims, you will have some foul smell coming from their oral cavity. Sometimes some secretions, could be blood, food particles, saliva and all, And plus with the advent of this swine flu and COVID, there are chances you may contract the disease if the victim has it. So this situation has happened many times. So what happens every time there is such emergency? Though people knew how to do CPR, they did not do anything because they thought, if I give CPR, I have to touch that victim's oral cavity and all. So they just stood and victim died. So what can be done in such scenarios? So taking all this into the account, the newer guidelines have come. They say, if you are not comfortable giving this mouth-to-mouth rescue breath to anyone, just continue with uninterrupted chest compressions at the rate of 100 to 120 minutes. And usually that is enough in reviving someone. So, as I said, you have to push really hard and fast. Your aim is to compress at least 1.5 of the AP diameter of the chest, which is around, 5 to 6 centimeter in a grown-up adult. And as I said, it has to be in cycles. So if more than 2 people are available there, make sure that, after 2 minutes, one person, after he gets tired, the other one should come and take over the CPR situation and all. That's how you go about the CPR in adults. Now, what if the victim is a child? If a full-grown child is there, so again CPR stays the same. You don't have to change anything. You do the same thing, head till chin lift, check for the breathing. If no breathing, you start giving the CPR. CPR at the rate of 100 to 120, and after 30 chest compressions, followed by 2 rescue breaths. It's just, you don't have to use as much of force as you would use in an adult. For example, in an adult, we use our 2 hands to give the CPR. In a pediatric or in a child, usually the force of just 1 hand is good enough to give the CPR. And what if the victim is an infant? By infant, I mean someone who is less than 1 year of age. So in those, you need further less force. So how do you give CPR in them? You either use your 2 fingers kept at the same point and you start giving them chest compressions, or alternatively you can use your 2 thumbs kept at the same point for giving the CPR. That's how we go about the CPR. Coming to the last letter D, that is applying a defibrillator. So how many of you have seen this device? It's called AD or automated external defibrillator. If any of you has, traveled through the Mumbai International Airport, on arrival port, you will see at every few meters, 500 meters, they have these red Philips devices kept over there. So what are those? Those are AEDs. What do they do? So every time someone goes into cardiac arrest, their heart goes through stages, It doesn't stop working entirely, but, it sort of quivers, makes some movement which are not strong enough to generate the pulse and the blood flow. So in those situations, this device delivers them a shock and the heart resets into the normal rhythm. So how do we use this device? All you have to do is just turn the on button, which is there on that device, and just listen to the instruction it gives. The first instruction it gives you is to attach these pads to the victim's chest. How do we do that? As we see in that figure. Yeah. So as we see in this figure, you take the first pad and attach it just below the right clavicle of the victim. Then you take the second pad and attach it just over the heart, that is on the left lateral side of the chest, and wait for the further instructions. Once you have attached the pad, machine starts analyzing the heart rhythm, and if the shock is required at that time, it prompts you to press the shock button. All you have to do is press the shock button at that time and the shock gets delivered. That's how you go about the CPR. Just to revise, I'll demonstrate it to you here. First thing, you make sure that the scene is safe for you all. Second thing, you check for the responsiveness by tapping the victim's shoulder hard and asking them series of few questions. Next thing you do is you ask for help. If there are more than 2 people available, you ask someone to go get the ambulance or go get the doctor at the scene. Next thing you do is you either check for the pulse or open the airway and check for the breathing. If you do not feel the pulse in next 10 seconds or you do not see the victim breathing within next 10 seconds, you start with the CPR by giving them 100 to 120 chest compressions in a minute, and ideally after every 30 chest compressions, 2 rescue breaths. If you have this AED device available, which is available at most of the stations in India, as well as many universities, sport institutions, you have to use that. That's how you go about the CPR. Post this, we'll have a brief presentation on the first aid also, and then we can have a hands-on so that one will be able to understand better. In the meantime, if you have any question about CPR, please feel free to ask. Yes, sir. Should I give? Should I?
Doctor, I want a clarification. Suppose a person having heart attack and the heart is weak and he cannot be operated under any circumstances. And in that case, whether we can apply the genes therapy coupled with artificial intelligence as now being done somewhere.
Yeah. So now many researches are going on. This artificial intelligence and machine learning is a way forward. Even we are looking to that. As such, at present, there is no device or algorithm has been developed, which will replace our heart and all. But even right now, many treatment modalities are available, even at the Dr. L.H. Hiranandani Hospital, where if someone's heart is weak and they cannot go that procedure you are talking about, we have certain devices. Many people have undergone those procedures where those devices have been put in to help the heart with its normal functioning.
This robotic and other things, it will be helping, no?
Yeah. But there is still time till those, yeah.
I think AEM hospital is doing that.
No, right now,
No?
not just in India, even in the world, no artificial heart has been created.
No.
So it's still work in the progress.
That is
Hopefully
in
that happens one
progress.
fine day. Yeah. No, left ventricle assist devices are there. No? Yeah, we are doing it. Yeah.
Just a quick question. Is there a situation, is there a chance that while I'm doing CPR, I may hurt the person? Given my size, and if it's a kid, right, I need to be sure what I'm doing. Right?
Yeah. So very good question. So tell you honestly, even when we doctors, nurses and paramedics are doing the CPR, many times we end up cracking their ribs and all. But while you are doing a CPR, you have to remember that the victim on whom you are performing the CPR, in a frank words, is already dead. And even if you try to harm a dead person, I'm sure you cannot inflict any more harm on it. So that way, that time you have to think about risk versus benefit and give the CPR. The only complication we usually see is cracked ribs and all. But cracked ribs are usually not taken any seriously. Even if a patient comes to us that my ribs is fractured and all, you will see the doctor's response is not that great. The reason being, yeah, it's a self-healing fracture. It requires no procedure. It heals on its own. That's all it is. So yeah, there are chances you may end up cracking the ribs, but you don't have to worry about because you are working, keeping larger interest of that victim in mind. That's fine. So one of the questions I get very frequently asked during these talks is, like how long to give the CPR, when to stop and all. To be honestly, like there are just two end points. One is that, you successfully revive the victim and victim starts responding. Again, like keep it in mind, the response will not be as it is shown in the movie, The victim wouldn't just get up, shake your hand, thanks, hand over his property to you. It doesn't work that way. The signs of them coming back to life will be very subtle. They may just open their eyes or they may just start breathing on their own or make some movement. Those are the signs of life you will be able to see. It has happened even in the hospital setting that, immediately after CPR, victim have woken up and said, oh, yeah, what happened to me? I'm just feeling some pain in my chest. So that also happens. But the response is usually very subtle. The other point when to stop is when the expert medical help arrives. As I said in the beginning only, ultimately you have to call an ambulance service or the doctor or someone who is expert in providing the CPR. So those are the two end points. Otherwise, you should continue till one of these two things happen. But again, on the humanitarian ground, if you are alone with the victim, you have been giving CPR for 20 minutes, 30 minutes, and you are exhausted, physically cannot continue further, then on a humanitarian ground, you can stop at that time. Yeah.
Sir, I want to ask you one thing. The face should be straight, or you have to give some sides.
So as I said, no, like if there are two people, then one should give the chest compression and the other should hold the head in the head till chin lift position so that the airway remains open. So what happens, sir, when someone falls unconscious, not be able to breathe because of that tongue obstructing their airway. So once you perform that head till chin lift, the airway gets open and they are able to breathe.
And other thing I had to ask you about after CPR somehow he is revived and he's okay. Can we give him water?
So again, very important question. Like especially us Indians have this habit. Whenever someone falls sick at home or unconscious at home, first thing we do is, pour something in their mouth, either give some sugar, or some food or some water and all. Just remember one thing, when someone is unconscious, strictly do not give them anything orally. Because what happens, we have these two pipes over here. We call one wind pipe through which we breathe and the other one is food pipe. When someone is unconscious, they lose control over it. And if you forcefully try to give something them to eat or drink, it ends up going into their windpipe and harming their lungs further. Yeah, you can give them something to eat or drink if they are conscious and able to speak. If someone is unconscious, take them straight to the hospital or wait for someone from the hospital to come and do something. Never give anything to an unconscious person, which is a very common practice in us Indians. Koi gira, we give them something to eat or drink forcefully. Yeah, don't do that. Yeah.
Other question I'd ask you.
Yeah, please.
Most of the things we don't know it is heart problem or something. But normally a few cases happened here. Their sugar go down. When they sugar go down and they get collapse. So we don't know exactly what is the reason. So in that case, what you should do?
So that's what, no, many times it's not possible to determine what has happened. Even we doctors can't say कि इसका sugar low है या high है unless we check it. Yeah. So again, as I said, like they should be taken to the nearest hospital as early as possible so that they are evaluated. If that victim is, conscious at that time, though had just collapsed, you can safely give him sugar. Okay, they can become disoriented, unconscious because of low sugar as well as high sugar. But low sugar at that moment is very harmful, so you can give them sugar. Even if it turns out to be high sugar later on, that's fine. We can take care of it very fast. So that's okay. Okay. So, yeah, why not? Many times, if their BP falls, they can faint and all. Yeah. So I just wanted to clear one thing. So I think many times people confuse cardiac arrest with the heart attack. The heart attack, cardiac arrest, and heart failure, these are three different terms as well as three different entities. Heart attack is something which happens when the coronary artery supplying blood to the heart gets choked up, and then victim gets that chest pain, sweating, uneasiness, breathing difficulty. Heart failure is because of the poor pumping of the heart, usually because of the ischemic heart disease or some other reasons where because of the poor pumping, fluid builds up in the body. You see them, swelling on their legs, breathing difficulty and all. And the cardiac arrest is the end of life event. In a pneumonia or anything. This is what everyone has to go at the end. Cause can be anything. Don't confuse it with heart attack. Okay? So I'll request Mr. Kazi to continue with his session.
Sir, one more
and
thing.
then we'll have a demonstration and we'll do more question answers.
Okay,
Yeah.
that's
No, ask.
No, the thing is that people who is above 70, 70 plus, most of the people having a swelling in the feet. What is the reason?
So swelling in the feet happens because of many reasons. The reason can be as simple as someone standing for the long hours. That is physiological because of the gravity fluid accumulates there. It can be because of reasons like thyroid issues. It can be because of anemia. It can be because of some local injuries. But more harmful causes of fluid builds up are usually poor pumping heart, leaky heart walls, poor functioning kidney and poorly functioning liver. So many things can cause swelling in the legs. Unless we do the detailed examination and test, it's tough to say, but many things cause. Yeah, so to begin with, you go to the physician only who will examine you, take your history, and then will decide like whether it's because of the kidney issues, then he will direct you to the nephrologist. If they feel it's because of heart, then they will direct you to the cardiologist. That way it happens. Thyroid ke liye physician or an endocrinologist, they can take care of it. Yeah, I'll request Mr. Kazi to please come forward and take the situation.
Thank you, sir. Good morning, everyone. I'm really happy to see all of you listening so consciously. And second thing, you are so enthusiastic and curious to learn. Okay, regarding that is TR. Regarding that, at the end, we will do practice session over here. Before that, we will learn about the first aid. Actually, as we learned in the BLS, how we can manage the airway. Yes? Here in the hospital, we are managing in all this airway, we are using, apply the pressure to the wound. What you will do? Just apply the pressure. Sometimes what happen? There is chances that our artery got cut. So what you will do? Simple, we can pressure over there. Next thing, raise the support and injured part. We will just raise the part so that with the help of gravitation, our blood will not flow unnecessarily. Next thing, bandage the wound. Just we have to bandage whatever things we have. Means in case there is no bandage, what you can do? You can take any cloth or handkerchief and just tie it so that there will be no bleeding. Next thing, check circulation below the wound. In case over here there is wound, below the that wound, we can just check the circulation. That means pulse we can check, or we can check whether blood circulation is there or no. Next thing, if severe bleeding persists, give nothing by mouth and call for emergency. Means there is too much bleed. What you can do? As sir questioned before, that whether we can give food or some liquid. No. If person is unconscious, at that time we should not give. As Dr. Samrat explained, that when we are unconscious, if we are drinking something, what will happen? Instead of going that food or liquid inside the food pipe, it will go inside the air pipe, which is not good at all. Okay? So, in summarize, if you are seeing for bleeding, what is important? Just stop the bleeding. And imagine if you are stopping the bleeding, you can save lots of blood from that person. And literally, its improvement will be good. Next thing, care for shock. In case shock is there. What is shock? Electric shock? That is another shock. Okay? But shock, normally, what we focus? Sorry? Painting. You're good. What's your name? Huh? Daniel. Very good. Daniel is so clever. He know what is shock. Okay? Normally, what we focus, shock means when fluid level or blood volume is less in our blood. Okay? So what we can do? First thing, we have to assess. As Dr. Samrat explained regarding DR, doctors ABCD, how we can assess. Same way we will assess. Next thing, we will call for emergency. Okay? Next thing, position casualty. What position you will give? Keep the casualty lying down in this way. Why lying down position? So that blood circulation to our brain will be improved. That is the most important thing. Next thing, elevate legs. We have to elevate the leg side, so that the more fluid volume which is stored in our lower periphery, it will come to the center, and which will help to maintain the circulation. Okay? Because at that moment, the blood circulation to vital organ is mandatory. Vital organ means brain, heart, any other injuries. Means any other injuries means, for example, any cut is there, any bleeding going on. So at that time, we can just tie any handkerchief or any bandages, so that there will be no bleed and blood circulation will be maintained. Next thing, ensure comfort. Cover casualty to maintain warmth and provide casualty with the fresh air. We have to provide person should be warm. Second thing, ventilation should be there. Otherwise, what happens normally? Everyone gather. Oh, what happened? What is going on? And in that part, we should provide the good ventilation and monitor and record the pulse and breathing. Okay? How to check pulse? Anyone? How to check pulse? Yes, very good. What's your name? Yes. Yes, very good. Nearby history. See, at that time, we should not check any other pulse in our body. Only we have to focus on carotid pulse. Okay? So, how to check that pulse? Simple. Everyone show 3 fingers like this, right hand. Everyone. Now you will learn how to check pulse, okay? Everyone show 3 fingers like this, right hand. Just place on the Adam's apple. Just place on the Adam's apple. Yes, middle. Just middle. Go 2 to 3 centimeter side. And press. Yes, right side. 2 to 3 centimeter. And press over there. You are getting something. Tuck, tuck, tuck. Everyone? You are getting? Yes? Very good. Daniel got it. Yes? In this way, we will check the pulse. You are getting, everyone? Anyone not getting, please raise your hand. Not getting? Everyone getting? Very good. That means we all are alive. Correct? We should thank God. Very good. Next thing, signs and symptoms of shock. When you are observing, so what are the signs and symptoms are there? First, most important, weak, rapid pulse. There will be weak, if you are feeling it, it will be weak and it will be rapid. Okay. Next thing, cold, clammy skin. Okay, it will be cold. So what do I have to do? I have to provide the blanket or something warmth. Yes, warmth. Next thing, rapid breathing will be there. Okay, so ventilation required. Next, faintness and dizziness. Faintness will be there and dizzy will be there. So make sure that that person should be lying down supine. We observe that that picture. Same way, person should be supine. We should not allow that person to walk. What will happen? Person may feel that, oh, I am young, I am so much energetic, I can do it. But no. What will happen? There will be two chances. First one, already he is having low volume of blood as well as fluid. Second thing, because if he is walking in this way, there is chances fainting will be there and person may get fall. And because of that, there is chances of injury. Correct? There is chances of injury. It can be for body or it can be for brain, which is not good at all. Okay? Next thing, nausea. There is may chances of nausea, means feeling of vomiting. Next thing, pale face and fingernails and lips. Mostly lips, face and fingertips. It will be pale. So that you can feel that, yes, person is having low volume or low blood. That means shock is there. Next, we will see about the sprains and strains. Most of time, whenever we observe such kind of sprains and strains, we may feel that there is chances of fracture. Mostly it is not fracture. Sometimes you may observe that when you are walking and something is there in between and our leg get twisted. Correct? Our leg get twisted and over there too much swelling will be there. At that time, most probably there is no fracture, there is sprains and strains. So what to do? For most important thing, you can remember RICE, R-I-C-E. Okay, RICE means not chore. Yes, it's another. That means whatever things are there. First thing, R means rest. Means we have to allow person to take rest. Next thing, ice. We have to use ice pack to apply over there, so that there will be no pain and person will be comfortable. Next, when we are applying the ice, make sure we are not applying directly. We have to cover with some kind of cloth or pillow cover and then apply it. Next thing, compress. Use the elastic or comforting wrap, not too tight. Means whenever you are applying, so just apply it over there, so that there will be no that much amount of swelling over there. Next thing, elevate. We have to elevate our leg, so that there will be no that much swelling over there. Clear about that? RICE understood? First thing, rest. Next, apply the ice. Next, we have to give the compression dressing. And next, we have to elevate the foot. Next thing, dislocations and fractures. Whenever there is fracture or whenever there is dislocation, whatever things we need to do. First, most important thing, we have to follow the doctor's ABCD. Means, we have to assess. Next thing, we have to proceed with the I act. First, most important thing, immobilize the area. For example, hand got cut, fracture is there. So what we will do? Don't move it. Immobilize it. How you will immobilize? You remember that we can stabilize. How to stabilize? Just take any kind of rope or handkerchief or any bandage, long bandage, and just apply over there and tie on near the neck, so that it will be stable like this. Clear about that? Otherwise, just allow person to be in supine position and keep their hand or their leg in the one position and provide supply that person towards the hospital. use jackets, pillows. We can use jackets, pillows, or blankets and stop the movement that injured part. Next thing, activate emergency service. Means we have to call to the any hospital nearby. Okay. So nearby our hospital is there, so we can call, and we will be ready. If any other hospital nearby, go ahead over there. Yes. Next thing, care for shock. See, care for shock. As we observed, whatever care we have to take for shock, that also we have to follow. Next thing, treat any additionally secondary injuries. In case any additional secondary injury, for example, cut is there, bleeding is there, wound is there, so we have to take care of that as well. Next thing, poisoning. In case there is poisoning, what we can do? First thing, same thing about the doctor's ABCD, and then we have to focus on the material safety data sheet. Means whichever the material that person, he or she consume, we have to see that whatever things are there, we can follow. Next, signs and symptoms. Most of time, we will observe that there is abdominal pain. Pain will be there. Okay, because patient consume, it will be inside the our stomach. Next thing we have to see, person will be drowsy. Person will be drowsy and not able to concentrate whatever things he or she is doing. Next, nausea will be there. Nausea means feeling of vomiting, and there is sometimes there is chances of vomiting. Next thing, burning pains from the mouth and stomach. Why burning pain? Because sometimes such these hazardous material may burn total mouth and total pipe, which is helping for our food intake as well as inside. Next thing, breathing difficulty. There is chances of breathing difficulty because that material may hamper our breathing system as well. Next thing, tight chest. It may affect on our lungs. There is chances of tight chest, and person may have hunger to breathe. Person will be such kind of things will be there. So in this scenario, act quickly and send person to the hospital. Then blur vision. There is chances of blur vision. Means person can't able to see properly or can't able to concentrate what he or she is doing. Okay. In this way, this will be there. Next thing, burns. Most important, whenever there is burns, so what we will do? Remove casualty from the danger. And then in that one, most important, stop, drop and roll. Whenever person is in fire, okay, any kind of cloth and everything got fire, so don't run behind that person. Okay, what will happen? Mostly that person will be in fear. Okay, if you are running, he may run more. And if he is running, what will happen? What will happen? Yes, fire will be more and more. Correct? So because oxygen is getting, so that's why tell person to stop. Shout loudly, stop, and show like this, stop. Okay, he may listen you. Next, what you will do? Drop and roll. Tell person to drop down on the floor and just roll over there. Okay, so that there will be we can reduce that fire. Second most important thing we can do, what you can do, take any blanket or anything and give to the patient, that person, and tell that cover with that, and then roll on. It will also help to reduce that fire. Next thing, cool the burnt area. Whichever part got burned, what you will do? Cool it. How you can cool? Hold burnt area under the cold running water for minimum 20 minutes. What you will do? Simple. Take, for example, hand is there, so just keep under the running water, so that it will get the severity of burn, it will get reduced, as well as pain also get reduced. Next thing, remove any constrictions, especially when patient is wearing any kind of tight clothes or jewelry is there, so remove it as soon as possible. Especially who are wearing the watch or any ring, remove it immediately. Remove it immediately. Why we have to remove? Because after some period of time, most of time, our body gets swelled. Okay? that much swelling will be there. We can't able to remove that ring later on. And later, place sterile and non-sticky dressing over the burn. Why we have to cover? So that we can reduce the infection. Normally, okay. Thank you so much. Acha, you understood about this? We have to cover the that wound. Why? Why? Naturally, God provide us skin. Skin cover whole body so that it helps to control the infection as well. But now in the burn, what will happen? There is reduce all the cover. There is no cover. So directly infection will come, and there is chances that we may get more and more infection. So what you have to do? Just cover with the non-sticky and sterile items. Clear about that? But don't apply directly cotton over there. If we are putting cotton directly, what will happen? Yes? Yes, it will get stuck inside, and in case directly we are taking to hospital, we also get more trouble to remove it, as well as person will get pain while removing it. Okay? So just apply the bandage over there. Clear about that? And then, most important, make person calm. Because person will be calm, so he will be happy, as well as resting will be help to improve. Otherwise he will be agitated, and he may do some activities which leads to more and more injury. That is not good at all. Next thing, most important regarding diabetic emergency. This is my favorite topic. So I will focus more in this one. First and most important thing, what we have to do? Follow the doctor's ABCD. Next thing, try to determine whether the individual is suffering from blood high sugar or low sugar. Okay? So mostly when you are checking, there will be high sugar, person will be thirsty. Okay? Person may ask for water. And in case it is low, so person will be hungry. Person will ask for food. That is the most in general we can categorize. Okay? Next thing, if you are unsure, then the best option is to give the person a sweet drink. Something sweet we can give if you are unsure. And then, as it is more important to maintain the minimum blood sugar. Normally, you might be heard that more sugar is not good at all. Correct? But when it is low blood sugar, then also it is not good at all. If it is less than 70, then there is chances that person may get various conditions, especially sudden cardiac arrest or diabetic coma, because our body functions with the help of sugar only. Clear about that? In next slide, we will see in detail how to manage hypoglycemia. Okay, monitor individual and wait for arrival of medical assistance. In case person is drowsy and you are not able to concentrate, then call for help. Hypoglycemia management. This is the most important. In last month, there are few incidences in our church. Are you aware about that? Yes? So there were hypoglycemia, and anyhow, I am happy that you tried to manage it, because our Sally ma'am, our director nursing ma'am, already part of this church. Okay? So, but still, I would like to know that every one of us should know how to manage hypoglycemia. Okay? So first and most important thing, whenever the person is having hypoglycemia, there is chances person may have drowsiness. First thing. Second thing, slurred speech will be there, and blurred vision will be there. Clear about that? Slurred speech and blurred vision. Next thing, person can't able to concentrate. If he or she is doing something, they can't able to concentrate. Next thing, they may have hunger. Okay? In case you are seeing all this condition and sweating as well. Okay? So what you can do? Simple. Check the sugar. Okay? Check sugar. You should have glucometer. Okay? it should be handy ready. We should not go to the laboratory or hospital to check sugar. It should be ready. Check sugar in case that sugar is less than 70. How much? Yes, less than 70 mg per dl. At that time, what you have to do? Take 15 gram of sugar, add in half glass of water and give to that person. Clear about that? How much? 15 gram. That means 2 to 3 teaspoon you can take. Okay? And just add inside and give it. Later on, again after 15 minutes, check sugar. And in case sugar is not handy nearby, what you can do? You can take any sweet, any kind of sweet nearby you can have, near about 15 gram. Okay? And after 15 minutes, that sugar is less than 70, repeat the same thing. What repeat? Again 15 gram of carbohydrate you will take and then check after 15 minutes. In this way you have to continue doing up to sugar is more than 70. Clear about that? But at that time don't think that, oh, he or she is diabetic and again I am giving more and more sugar. No, at that time there is requirement of sugar. Okay, there is many chances that that person had insulin and doesn't have food. That's why sugar is going down and down and down. Otherwise, that person may had exercise, nice vigorous exercise. Yes, I have to maintain my body, I have to be free from diabetes and I am doing exercise and later on I am not having food. There is chances of sugar down. Okay, so at that time managing that sugar is vital. Clear about that, everyone? So in this way, we will continue and then up to 70 mg per dl. In case he or she is not getting managed, please take assistance from any doctor or go to the hospital. Next thing, most important, wherever we are, we should have first aid kit. Okay? Why? Because in case of such kind of wound, any injury or diabetes is there, hypoglycemia is there, so at that time immediately we have to act. We should not think, oh, what to do, where is the bandage, what to do, what is there, where is sugar. No, everything should be ready. We should keep one side. See, for example, fire extinguisher is there. Yes? So now in case there is emergency, you can take fire extinguisher and use it. Same way, first aid kit should be ready. And BP apparatus, whatever things are there, whatever things should be ready, BP apparatus, HGT machine, SpO2 machine and thermometer. These are basic things. Okay? It should be ready so that whenever there is emergency, we have to quickly take it and use it. Clear about that? Everyone? Very good question. HGT in the hospital setup, we are calling HGT to the blood sugar. Okay? When we are checking blood sugar monitoring, so that is called as HGT. Okay? Hemoglucose test. SpO2, normally we are seeing oxygen level in our body. Yes, oxygen saturation. Correct? So that machine should be ready. Okay? Next thing, standard precautions. Whatever the standard precautions are there. These are the standard precautions whenever we are handling any kind of patient. So these are the standard precautions we should follow so that we should not get infected or we should not be in trouble. Okay? For example, any kind of body fluid or blood we are handling, we should wear the gloves. Okay? And in case any touch to any body fluid, so we should do hand wash. For hand wash doesn't require any kind of special things, just we can take our soap and water and we can hand wash. Okay? Then whenever we are handling any sharp, that is most important thing. Whenever handling sharp, so we should make sure that we are not getting cut by us as well as to the front person. Okay? And it should be discarded safely. These are the all things in standard precautions. First thing, to control the infection, whatever things are there, hand washing. Second thing, we have to use the gloves. Then mask and the special goggles. Especially in the COVID, you are aware about PPE? PPE? Yes, personal protective equipment mostly in the COVID you used to use, but everything we doesn't require to use. As per use, we have to utilize it. Okay, then sharp container, and then whatever the hazardous material means any cotton is stained with the blood, we have to discard safely. Yes, so in this way we learn about the first aid and whatever things we need to do. Any doubt? Yes.
You said everything about injury.
Yes.
But in any case, any internal injury. In case if any internal injury, you cannot make out.
Internal injury. Yes. So in case there is internal injury, so most of time person will be having dizziness, correct? Or person can't able to talk, can't able to discuss. Okay. So in this case, we can run to the hospital. Yes.
So by and large, just remember one thing. If someone is very sick, the basic things you need to do is, make sure that the person remains comfortable. They need rest, So don't go and keep asking that person, how you are, kaisa hai ye wo. So they have to burn as less calories as possible. Okay? If next, probably open a button or two so that they are able to breathe freely, and then take them to the hospital. Always remember, everything cannot be managed at home by yourself. So try and take them to the hospital as early as possible. Heart attack and all, I know many messages come on WhatsApp, ki make them cough, make them do this, give them this. Nothing works. You have to get them to the expert as early as possible.
Sir, I have a question. Here. Sir, in a situation where a person is alone, and if his feeling is collapsing, what shall be done?
Yeah.
If I am alone in certain place,
Yeah. So you won't believe, like, such things have happened in a real life scenario also. So we had a patient who was driving and he felt something is wrong. The smart thing he did is, he immediately alerted one of his friends that, I'm stopping my car here and here, I'm not feeling unwell, and, eventually the ambulance came, got him to the hospital in a time. But when someone is alone, what should that person should do? Yeah, be alert. If you are not feeling uneasy, stop whatever you are doing and get in touch with the nearest healthcare facilities. Once you have given them an SOS, I am sure even if you are unconscious, by the time they reach, they will reach there. That is there. And certain things as you can do is, probably open up the window, let the room be ventilated, alert your neighbor or the best friend, whoever is close by, so that they can do. There are many things being said, like it has to be situation specific. Like for example, if some diabetic is feeling sweaty, uneasy, unwell, and then probably he can munch onto some sugar. That's what he can do. If someone is feeling like they are going to faint and all, then they should probably lie down on the bed with their legs raised a little bit and all. Okay, if they are having breathing difficulty, I'm sure like nobody has oxygen concentrator at home. At least probably open up the window, 2 shirts and all, make things easier for you. But as I said, most of the things cannot be handled at home, especially things like heart attack and stuff and all. You have to reach to the hospital. Another thing which one can do is if someone is experiencing anginal heart attack symptoms like chest pain, very profuse sweating, breathing difficulty. In that case, if they are not allergic, then they can proper tablet of aspirin or ecosprin. So that helps in a great deal. Other than that, I don't think so much can be done rather than going to the hospital. Yes, sir. Demonstration के लिए ready कर दो. हाँ. Yeah, so not according to age. Even in him, me and you, sugar will vary throughout the day. That's how our body works. That's why we have to replenish it by eating it. Yeah, that's fine. So the level at which you keep your sugar varies from person to person. For example, if an healthy individual is there, in him 173 is not acceptable. But someone who is already diabetics, for them, yeah, it is okay. That way it is. Yeah. Similarly, for blood pressure, if some 20, 30-year-old has got his BP, then our aim will be able to, to keep it in the range of 120 by 80. But if it is 60 plus %, then maybe we'll be little relaxed with that. For them, even 140, 130, in few even 150 is acceptable. That way. Yeah, in a extremely obese. Yeah.
80 plus means up to 50, 60 is over.
They need to take medication, but yeah. Shortly, we'll start with the demonstration and we'll do the questions simultaneously, please.
Yes, I will start.
Those who are asking question, you can ask in Malayalam also. Okay, don't worry that if you are not able to speak in English, you can ask in Malayalam as well.
We have the
Please
best
do not
possible
miss
translator
important
here.
points in your life. ആർക്കെങ്കിലും എന്തെങ്കിലും ചോദിക്കാനുണ്ടെങ്കിൽ മലയാളത്തിലും ചോദിക്കാം കേട്ടോ.
Yes, at the end we will ask questions.
Sean,
Many a times, this is a real thing. Our neighbor's daughter, she was not well and she fainted. We did not have this thing, sugar level tester. We all of a sudden made her sit down and gave some shikanji and added some sugar. Now I don't should we add salt to it or sugar only 15 grams? How do we understand that?
It again depends on a individual to individual. For example, I don't have a diabetics, so if I faint, then it's definitely not a low sugar and all. If your neighbor's daughter was a young person and all, it was definitely not low sugar. So what is fainting exactly? Transiently for some reason, sometimes the blood flow to the brain get disrupted. That's why one faints, falls down. The reason could be, if someone was sitting for a long time and then suddenly stands, that time also it happens. If someone is pain, that time also it happens. If someone is dehydrated, whatever reason, because of the excessive dose of the blood pressure medicine or during fasting and all, during praying and all, if lots of crowd is there, sweaty environment, we get dehydrated. So giving them water in any form with extra sugar, salt is fine. Nothing wrong was done. But given the young age, it was unlikely that she had hypoglycemia. Yeah.
Yes. As sir was asking about the blood sugar level, so it should not be less than 70. That is the most important thing we should notice. Okay, if it is going less than 70, it means it is hampering to our brain as well as heart. Okay, because our body needs energy and energy comes from sugar. Okay, so that is most important thing. It should not be less than 70, and before food it should not be more than 120. That is the thing we should take care. And after food it should not be more than 180 or 200. But it depends on the person to person. Vary. Clear about that? It should be said by your doctor or diabetes educator how much require as per your body. Now we will focus on main thing, that is CPR. Correct? So we learned about the CPR, how it should be done. Now we will focus practically how we can do it. Okay? Are you ready? Enthusiastic to learn practically? Yes. So now first thing I will demonstrate, and then later on one by one amongst you at least 2 to 3 persons should come and demonstrate. Okay? So first and most thing, what we have to do whenever we are doing CPR, yes, breathing, pulse and everything. Before everything, most important thing is that we should not be panic. Yes, we should not be panic. Leaders never get panic. If we are getting panic, we are not able to control the things. Clear about that? Why we should not panic? Because we are aware what we can do it. Okay? Next thing, what you can do, check for the before pulse. What we will do? Before breathing,
Consciousness.
before everything, we have to make sure that place is safe or no. Okay? First thing, should not panic. Second thing, we should see that whether that place is safe or no. For example, you are there in the Ukraine. We are aware about Russia, Ukraine. Yes, you are aware. War, correct. So, in case you are there, and if you observe some victim is there, so don't start, oh, I know how to do CPR, I will go, I will do it. No. First thing what you will do, take that victim to the bunker or something, somewhere safe place, and then continue it. Clear about that? For example, if you are on highway and you observe that one person got accident and he is lying on the highway, so what you can do, don't start CPR over there only. Take to that victim to the roadside and then continue. Otherwise another truck will come and there is chances of you will be second victim, who should not be. Yes? That is most important. Next thing, you will check the response. How to check response? Tap on the shoulder. How to tap? You have to tap on both shoulders in this way and ask with the name. If you know the name. How? Mr. Henry, are you okay? Mr. Henry, are you okay? In this way, you will tap and you will ask the name. Okay? In case, after 2 to 3 time asking, if there is no response, that means there is something not good. Then what you will do? You will ask for help. You will shout for help loudly. Help, help, help. So that someone will come. Don't shout normally, help, help, help. No one will listen. Okay? And yes? No, it's good. It's good then. It's good. Okay? So, you have to shout loudly in that language, which language is understandable for everyone. Next thing, what you will do? Someone is coming for help. Meanwhile, check the carotid pulse. Everyone check pulse. Everyone. You are aware now, correct? Just place 3 fingers on middle, that is Adam's apple. Just go 2 to 3 centimeters side and press over there. There is tuck, tuck, tuck. Everyone getting? Yes, that is carotid pulse. Okay? So later on, you should do practice so that in case of emergency, you can see it, whether you are getting or no. In case there is no pulse, what you can do? In case there is no pulse, what you have to do? You have to start the chest compression. How to place? Simple. You have to place this part. Where you will place? Just on the chest. Where exactly? Imaginary nipple line, middle one. Okay? Can you see over here? Imaginary nipple line, middle one. Otherwise, this sternum bone is there. Okay? 2 to 3rd below. Just want to make 3 part and the last part one over here. You can place heel of the palm over here in this way. Clear about that? Yes? We will place it and then you have to place another hand and we have to interlock. In case you are wearing any ornament like ring or watch which is hindering to give chest compression, just remove it. Okay? And then we have to start the chest compression. While giving chest compression, make sure that your elbow should be straight. Your elbow should be straight and then total power should come from the shoulder. Next thing, when you are giving chest compression, so it should be straight way 90 degree and go down. Okay? When it is going down, how much depth should be there? At least 5 to 6 centimeter. Clear about that? It should go down 5 to 6 centimeter. And then after going down, come up totally. So that there should be complete chest recoil. Why? Because what we are doing exactly by giving chest compression, we are doing function of heart. Normally our heart get pumped Now it is not getting pumped because there is no pulse. That's why we are giving chest compression so that our heart get pumped and we can ensure that there is blood circulation. Clear about that? And God made our heart so safely. Can you see total chest muscles is there, then bones are there, then lungs are there, under there various layers are there, and then inside there is heart situated. Okay, so that's why from outside we are tracing it so that we can do the function of heart. So what we will do, we are placing it and then we are doing the chest compression. Clear about that? So that chest circulation will be recovered. And then after doing 30 chest compression, and that speed how much should be there? 100 to 120 per minute. That much speed should be there when you are giving chest compression. Means when I am starting, that speed should be 100 to 120. And then after each 30 chest compression, we have to make sure we are giving 2 rescue breath. While giving rescue breath, head tilt, chin lift we have to do. Why head tilt, chin lift? As Dr. Samrat explained that whenever person is unconscious, mostly what happens? Yes, tongue get fall, so that our airway get blocked and person can't able to breathe. So simple, head tilt, chin lift. And then do nose pinch, then our mouth with victim's mouth. We have to seal and then give the breath. One breath in 1 second, then wait for 1 second, then again another breath for 1 second. Okay? Then wait for 1 second. In this way, I again come to the chest compression. How much? 30. So 30 chest compression, 2 rescue breath. In case you are not happy to give rescue breath mouth to mouth, you can continue chest compression only. Clear about that? Yes? Any doubt? Now we will do practically down. Someone come and just show me. Okay? If there is something soft is there. Why? Because person can't able to get good amount of chest compression. Something hard should be there. Okay? Sometimes I observed that we are thinking that person is something great, something CEO or my boss is there. How I can take down on the floor? I can give on the sofa or bed. No. Any person at that time, that person is victim. Clear about that? So I have to take down on the floor and then continue. It will be more effective rather than doing on the sofa or bed. It's not good at all. Clear about that? So I'm just showing you practically down how to continue chest compression. Okay? And later on, you have to come and you have to demonstrate. One from this side, at least one from this side and one from this side. Okay? And then we have to place our hand this way, and then our total power should come from shoulder. Okay? And then our elbow should be straight in this way. And then we have to continue chest compression. Can you see? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Yes? And then head tilt, chin lift, nose pinch, out 100, second. Okay. Then we are going with chest compression 30 finish, and we are going for rescue breath and coming back. That timing should be less than 10 seconds. Okay? Because chest compression is more important rather than giving breath. Clear about that? Everyone? Yes. So please come one by one and just demonstrate so that we can clarify our mind. Okay? Thank you so much. Yes. you just check for response. Tap. Ask Mr. Henry, are you okay?
Hey, Mr. John, are you okay? Mr. John, are you okay?
He's not okay. Help, help.
Help! Help! Help!
Very nice, very nice. Yes, you ask for help. Yes, someone come here for help.
Somebody please come for help. Young people, run.
Yes, very good. Daniel came. So Daniel, you should be here. Come here. So you can tell him, call for ambulance.
Call for ambulance, ambulance.
You died.
Ambulance, come, come, ambulance.
He's calling ambulance. Okay. Everyone should know ambulance number, emergency number, so that in case of emergency, we can be ready to call. 108, 108. For India, there is 108 normal ambulance. Okay. Next thing, you are checking pulse now. Not there. From here to the side. Yes. Press. You can check yours. Check. Or check mine. Check mine. You are getting? Yes. Very good. Not there. From here. From here. You are getting? Yes. So if you are getting, it's good. If you are not getting pulse, that means person's heart is not working. Then we will go ahead. Yes.
Not getting.
After CPR, then it will get.
Okay.
Yes?
I just don't.
Yes, I understand.
Okay.
Yes. Now you have to place over here. You come little bit near to the. Very good. Now here, most important thing, after doing 3 to 4 cycle, we have to check pulse. Okay? And in case anyone is coming for help, so you can continue chest compression and he will give mouth to mouth breath. Okay? So that you will not get tired. And after 3 to 4 cycle, again you have to check pulse. At that time, you have to change the cycle. Means he will do CPR and then he will focus on the giving rescue breath. So that we will not get tired easily. Okay? Yes? You are getting pulse. Very good. Very good. It is achieved, that means. Yes. Here I would like to tell that he is the most youngest and most enthusiastic who is performing the CPR. Very good. 79. Wow. I would like to call young people, please, because yes, actually everyone should do this practice. Okay, because in case of emergency we should be ready to do the CPR and to save the life. Most of time we are with whom? Yes, we are with our loved ones, our family, our friends, our colleagues, correct? So in case something happened, what we have to do? Same thing, so that we can revive the person and we can be hero. Yes? Come on. Yes. Your name? Aaron. Yes, Aaron. Come on. Yes, tap. First we will check the area, whether it is safe or no. Safe? Yes. Both sides. Ask me. Mr. Henry, are you okay? Are you okay? Huh. Yes. Huh? No? Yes. Then what you will do? Now person is not okay means we have to call for help. Here most important thing we should not take for granted. Sometimes we may feel, oh, I know everything. I will save the person, I will become hero. No. In case of such scenario, if I am there, if Dr. Samrat is there or our Sally ma'am is there, we also not do alone. In hospital also we are not doing alone. We are calling for help. So make sure that you are calling for help. Call someone. If they are known or unknown, call them so that it will be easy to execute the everything on possible way. Okay? Yes. Go. Yes.
Help! Help! Call the ambulance! Help!
Yes. Come, someone. Come. Please come. Yes. Now he came. Yes. You be. No, you come. Yes. So now you have to tell him. What you will tell? Call ambulance. And you, what you will do? You will not waste time. You will check the pulse. 108. Yes. You are getting pulse?
Hello.
You can check. You can pulse check. Just. Yes, very good. So in this way, what to check pulse? If it is not there, then continue the chest compression. Go ahead fast. See, what we elbow should be straight. Yes. Power should come from shoulder. Go ahead. Yes, 32, 30. Speed should be there. Speed how much? 100 to 120 per minute. Speed है. और स्पीड चाहिए. गुड. नहीं 30 के बाद दे सकते. Elbow should be straight. Elbow should be straight. Come on. Yes, now go ahead with the breath. Yes? Yes, our mouth should be totally blocked with the person's mouth because air should not get leaked from here and there. Clear? Huh? No, after giving rescue breath, continue the chest compression. Don't wait. Yes, while giving the breath. Later on, remove it. Very good. थोड़ा speed बढ़ाना है. Yes, please. Well done. Huh? Chalo gan. Very good. We achieved it. Yes. Very good. Thank you so much. You all are really enthusiastic as well as curious about each and every point of knowledge. Okay. Please use it whenever there is such kind of scenario. Okay. Thank you so much. Thank you. Yes. You are righty? Yes. So place right hand first. Yes. And then left. Yes. Main thing total shoulder. Yes.
Question number 1. I've seen a patient having fits and falling down on the road. CPR does not apply to them. Question number 1. Question number 2. If a person has a bike accident
First, your question was.
Excuse me, we are coming to the end of the program. In 5 minutes, we will wind up. Those who are leaving the church are requested to stay here. Please do not leave the church until we wind up, please.
That's correct observation. The CPR is for those who are in cardiac arrest. If someone has had seizure, they are still alive. CPR does not apply to them. If someone is having seizure, usually it's self-limiting one. It stops in couple of minutes. But what are you supposed to do at that time when someone is seizing? Just roll that person to one side, okay? And that's all you have to do. You generally see the practice when someone is seizing, having fits, people try to forcefully, put them down and all. But that results in significant musculoskeletal injuries. We have had cases, we have fractured their arms and all. So let them seize. You can't, it's a involuntary, violent contraction of the muscle. You can't stop it by pinning them down. In fact, you end up, fracturing their limbs and all. Second thing is, do not try to forcefully put anything in their mouth. The practice is people put spoon and all and their teeth breaks and all. Just roll them on their side, like how we sleep, so that, with that, if you do that, their breathing remains, intact. That's all you have to do. And if it's a patient who is known to have seizure, they usually have those medications to be used in such situations, give them. Otherwise, do not do anything else. Do not pin them down, do not put them in mental. CPR does not help them. Yeah, a seizure patient, if it goes into cardiac arrest, then only CPR. The second question you said? Yeah.